Welcome to the TennCare Connect Applying for Coverage video. This video shows you how to sign into your TennCare Connect account and apply for coverage. TennCare Connect is where you can find your member information and complete key benefit actions. You can apply for coverage, check your benefits, upload a document, complete your renewal, or report a change. This video provides instructions on how to sign in to your TennCare Connect account and apply for coverage using a sample application. If you do not have a TennCare Connect account, view the Create an Account video for guidance on creating an account. To begin, open your web browser and go to www.tenncareconnect.tn.gov. Click Sign in the top right corner of the page. On the TennCare Connect sign-in page, enter your username or email address and password. Click the box next to I'm not a robot. If you're asked to select pictures, respond to the request. Click Login. On the Coverage Overview page, click Apply Now. On the Apply for Coverage page, read the instructions and helpful tips in the Before You Begin section. It takes most people 30 minutes to fill out an application. Tell us as much information as you can when you apply. After you begin your application, you can stop and save your answers at any time by clicking Save and Exit at the bottom of the page. When you are ready to complete your application, log back in and continue where you left off. To continue, click Next. On the Getting Healthcare with TennCare page, review the types of public health insurance offered by TennCare. Click Next. On the Household Information page, enter the first name and last name of the head of household, or the person who is mainly responsible for taking care of the TennCare Connect account and the family's health insurance. In our example, Leah Bell is the head of household and applying for herself and her son Michael. Throughout the application process, questions with a red asterisk mean it's required to continue. Select your language preferences. Notice the information icon. Throughout the application process, you can hover over the information icons to read additional information about the questions. Let us know if you are homeless or living in a shelter. For our example, we'll select No. Next, select your address format and enter your address, city, state, zip code, and county. If your mailing address is different than where you live, select No and enter your mailing address. For our example, we'll select Yes. Provide contact information and the best time of day to receive a phone call. Providing a phone number is not required, but it is highly recommended to help us get in contact with you about your application. Now, tell us if you are applying for yourself or someone in your household, or if you are an assisting person helping someone else apply. For this example, we'll select Self. If you're applying for yourself, tell us if you would like to add an assisting person to your application. An assisting person is anyone who you would like to help you manage your coverage or receive your notices. If you are acting on someone else's behalf, or if you would like to designate someone who can act on your behalf, complete the Assisting Person Information section. Notice the blue information link. Throughout the application process, you can click the blue information links to display a pop-up window for more information. Click X to close the pop-up window. However, for this example, we'll select No, the applicant does not wish to add an assisting person. Click Next. The address validation pop-up window matches the address you entered to the closest United States Postal Office registered address. We recommend you select the registered address if it's displayed. If not, check to make sure you entered your address correctly and select the address I entered. Click Submit to close the pop-up window. Click Next. On the People in Your Home page, Read the instructions on who to include on your application. Provide information about you, including any alternative name information, your gender, your date of birth, and if you are applying for coverage. Additional questions may appear depending on your answers. Providing a Social Security number is not required, but is recommended to help speed up the application process. Since Leah Bell is applying, we'll answer citizenship, living arrangement, and Tennessee residency questions. Answering race and ethnicity questions are optional and are not used to make a decision about your coverage. However, you must answer if you're a member of a federally recognized tribe. Click Next. The Verify Your Identity pop-up window appears if you provide a Social Security number for the head of household. Answer the questions to confirm your identity. For our example, we'll select None of the above does not apply for each question. Click Submit. On the Additional Details page, answer the additional questions. In this example, we'll select Leah is not pregnant. Additional questions may appear depending on your answers. You may see additional questions related to school enrollment, employment, former foster care, and emergency medical services based on the age and citizenship status of the applicant. Click Next. On the Summary of People in Your Home page, review the information for the head of household. Click Add Another Person to add additional household members. On the People in Your Home page, enter the first name and last name of the household's next individual. Select if the person is known by any other name. Select the gender and enter the date of birth. Select if the individual is applying for coverage. You may enter the Social Security number. For this example, Michael Bell is applying, so we'll answer citizenship, living arrangement, Tennessee residency, and if he's a member of a federally recognized tribe. Selecting race and ethnicity is optional. Click Next. On the Additional Details page, answer the additional questions. In this example, we'll select Michael Bell attends school for 12 or more hours per week. Additional questions may appear depending on your answers. Click Next. On the Summary of People in Your Home page, click Add Another Person and provide their information until you've added all required individuals. Once everyone has been added, review the table to make sure the information you entered is correct. If you need to make a change, click Edit. Make the change on a previous page and then click Next until you return to the summary page. If you entered the same person more than once, click Remove twice to delete the extra entry. Once everyone is added correctly, click Next. On the Relationships page, select the relationship of the head of household to other members in the home from the drop-down menu. The corresponding relationship displays under the question. For children, select if anyone in the home is the child's primary caregiver. If yes, select who. Up to 2 people can be selected as primary caregivers. Click Next. On the Other Health Insurance page, select if anyone in your household is enrolled in health insurance other than TennCare, Cover Kids, or Medicare. If yes, enter the health insurance details. For our example, we'll select No. Click Next. On the tax filing page, select if anyone in your household plans to file a federal income tax return the next time taxes are due. If yes, select Who and enter the tax-dependent details. For our example, we'll select No. Click Next. On the Tax Filer Outside Household page, Select if anyone is being claimed as a dependent by someone outside of the household. If yes, select who is claimed as a dependent and enter who claims that individual and their relationship. For our example, we'll select No. Click Next. On the employment page, select if anyone in your household has a job now or will start a new job this month, excluding self-employment. For applications with pregnant women or children applying for coverage, the question also asks if anyone in the household had a job in the last 3 months. For this example, we'll select Yes. Select who has the job. In our example, Leah has not lost this job in the last 3 months. Enter the employer name. Entering the address, employer phone number, and start date is optional, but helpful information to provide. If you are unsure of the exact start dates for income or any other reported information, you can enter the approximate start date. Next, select if you want to report how much you make per hour or per paycheck. For this example, we'll select amount you make per hour and enter the average number of hours worked per week and the amount made per hour. You can also click the Add Comments to your application hyperlink to add additional information TennCare should consider when reviewing submissions that otherwise wasn't requested on a page. For our example, we'll enter that Leah received a pay raise from $10 to $11 per hour this week. Click Save to save your comments. Comments from multiple pages are combined and can be reviewed on the Review Your Comments page prior to submission. Click Next. On the Summary of Employment page, review the table to make sure the information you entered is correct. If you need to make a change, click Edit. Make the change on a previous page and then click Next to return to the summary page. To delete a job, click Remove twice to delete the job. Click Add Another to report another job for someone in the household. Once all jobs are added correctly, click Next. On the Self-Employment page, select if anyone in your household is self-employed. If yes, select Who and enter the self-employment details. For our example, we'll select No. Click Next. On the Other Income page, select if anyone in your household receives other kinds of income, for example, alimony, child support, a pension, supplemental security income, social security income, unemployment insurance, sick or disability pay, or veterans benefits. For applications with pregnant women or children applying for coverage, the question also asks if anyone in the household received other income in the last 3 months. If yes, select Who and enter the other income details. For our example, we'll select No. Click Next. On the Other Healthcare Questions page, select if anyone in your household wants to get or keep help paying their Medicare costs, has temporary coverage for breast or cervical cancer through the Department of Health, is applying for the Katie Beckett program, has medical bills in the last 3 months, is in a medical facility like a hospital and has been or will be there for 30 consecutive days, needs nursing home care, needs hospice care, is requesting home and community-based services or HCBS, is requesting HCBS and wants to participate in employment and community first choices, or needs intermediate care for individuals with intellectual or developmental disabilities. If you select yes to any of these questions, select Who and select if anyone in your household has expenses or resources. For our example, we'll select No to all questions. Depending on your answers, additional pages may appear to report details for household expenses, medical bills, or resources. Click Next. On the Application Summary page, you can click each section title to expand and review the information you've entered in each of the application sections. If you need to make any changes, You can click the section in the progress bar above to edit your answers. Click Next. On the Review Your Comments page, review all comments you've added throughout the application process. You can add or edit the comments before submitting your application. Click Next. On the Before You Submit page, select if you are registered to vote where you live now. You can register to vote online or request an application to be mailed to you. In the Renewing Coverage section, you can choose to give us permission to use your tax information to try to automatically renew your coverage in future years. Select the number of years you would like for this to occur, up to a maximum of 5 years, or decline this option. For our example, we'll select 1 year. In the Health Plans section, you can select your health plan preference. If you don't have a preference and you're approved for coverage, we'll pick a health plan for you. For our example, we'll leave it blank. Click Next. On the Sign Your Application page, carefully read about your rights, responsibilities, and penalties, your right to privacy, and the Non-Discrimination section. In the Electronic Signature section, read what you're agreeing to when you sign and submit your application. In the Applicant Signature section, provide your signature by clicking the box and typing your name in the signature field. Click Submit. Congratulations! When you see the We Have Your Application page, you have successfully applied for coverage. Please save your application tracking number. It always begins with a T. A copy of your application is saved in your TennCare Connect account, and you can review it anytime by logging into your account. However, if you wish to print your application, you can by clicking Print. You are not required to provide any documents at this time, but you can by clicking Upload Documents. The TennCare team may send you a letter in the mail if any additional information or documents are required. Click Next to return to the Coverage Overview page. This concludes the process for applying for coverage in your TennCare Connect account.